Yeah.
One word. One word.
What's that?
Dire wolf.
Oh, you saw that? That was kind of cool. Yeah,
10,000 years from a tooth.
yeah, we're living in Jurassic Park. Uh, and they got the woolly mammoth mouse was the thing like a couple weeks ago, I guess, right? Did you see that one?
I did not.
Yeah, they
A
bred a
mouse has.
mouse that has the hair of they put the hair genes of the woolly mammoth in it as like a test that they can bring it back or something like that.
Yo,
So pretty neat.
radar.
Of course.
Radar, we're
Um,
talking about dire wolves because we're waiting for everybody.
Radar, I did watch Dr. Hill's stream last week, and I did want to note that he did agree with us and with Jay that there really seems to he said there's no reason I can think of to raise frontal alpha and I would avoid it. So I don't know what you thought about that, man. And it might also interest you, Radar. There's some research out there that I can find for you if I need to. But there's this idea. So frontal alpha is associated with creativity. But what they found out is the marker of whether you can increase your frontal alpha when you need to is how decoherent or unsynchronized your alpha is frontally. As you may know, so decoherent alpha, so coherence and power are correlated. So if you train up your power, you'll be training up your coherence, and in theory, that will be against creativity.
You feeling ballsy there, Anthony? You're going to start answering questions?
Well, I just know what Jay and Dr. Hill said, and I know the papers I've read, and they're pretty. So yeah, you don't remember too, Radar, that alpha represents inhibition, and FZ is what we're talking about, and so that is what Dr. Hill. I've watched him answer your question, and so I would just be cautious. The other thing is, I had some frontal alpha in my EG. Just speaking of, and when Jay looked at my EG, he said, I believe that was when he said, this is associated with akinetic mutism. In the extreme, it arises at akinetic mutism, which you may have heard Jay talk about. I think I have this right. We can ask him, but basically, it's kind of like lethargy. They have such a profound lack of dopamine they can't speak. So anyway,
You want to get on that bipolar too?
yeah, I'm not familiar with bipolar inhibits increasing coherence. Maybe it depends where they're increasing the coherence. That's above my pay grade. But I do know, so Jay will talk about it. He says entropy is the EEG is a measure of entropy, and there's studies you can find that creativity was associated with higher entropy in the EEG. And if you look up what entropy in the EEG is, it's noise. It's uncorrelated noise. Because my understanding is what these brainwaves are, if there's a rhythmic pattern in a area of your brain, that brain is engaged in tasks and unavailable for use. In other words, it's less modular. Whereas when a brainwave area is decoherent and it has this noise, I think sometimes they're also called uh, fluctuations, slow fluctuations. I think they call them because they're slower than, or they're very slow in the delta, like less than delta range, less than 1 hertz. That's what's supposed to be there. And when that's not there, things are already organized in such a way that now when you need them and you need to pull off brain regions for tasks, you can't because they're already collected in this unmodular fashion. Yeah, I'm reading this now, Radar. Have I heard of Dan Mouse Squash F? Sorry, my contacts are messed up right now. T6 to F8 and T5 to F7 broad inhibit 2 to 38. That is supposedly yeah, I have not, and so I can't. You're right. I can't speak to what every protocol is doing. I will say that the principle that power and coherence are correlated, that does seem to be borne out, at least in my research, and so how they get, maybe there's unconventional ways to arrive at certain levels of coherence and decoherence, so maybe that's what those are doing. And yeah, maybe one of these guys like Dr. Hill or Jay will can answer you on that specific protocol.
Well, we can
But it
also
is, yeah, go on.
we can jot it down and we can go over it, on our Thursday show tomorrow.
Yeah, why don't you screen cap or something? It is cool. I do appreciate that Radar is like the most he feels like he's like the most advanced and all, he knows a lot and he's really interested and or she, I don't know. And I think that's really cool. And so the questions are challenging and it is good to think about these things. So
Well,
and
maybe
we do.
Radar needs to be on the other
Yeah.
side of things. Maybe
Yeah.
they should be with us right here.
But Radar, one way to test whether this person's protocol works is to measure, is if you can give yourself an EEG or however you
You got that right.
just measure. I mean, if you see your coherence going up, then maybe this person is the protocol works. It could very well work. I don't know. I do find I'll tell you an experience of a friend of mine. As they are, I think I mentioned this friend before, but as they are suppressing their frontal slow and fast waves, so they're doing broadband inhibit. They're basically suppressing everything but the 12 to 15. They're suppressing alpha, beta, theta, delta. Um, as they are doing this, I have seen so many and this was recommended to them by Jay and other clinicians. I've seen so many positive changes. I've seen increased empathy, but not only that, their processing speed has gone through the roof. I can't do these frontal inhibits yet, but I'm jealous because it's producing a big effect. And Jay has a paper that he did that study on addicts I brought up, and frontal suppression, frontal broadband inhibit is part of what they did. And he says those addicts gain 20 to 30 points on standardized cognitive exams, which I think includes basically its equivalence of IQ tests. So after seeing this transformation of my friend, I have no trouble believing that, Radar. And like I said last time, I was really for you is maybe just try correcting your phenotypes, kind of the Gunkelman, Johnstone, Lunt phenotypes, that paper. Maybe just try treating your feet, so if you have frontal slow waves or fast or alpha, maybe you've already done that. But see if you reduce them and see if you get the improvements that you want. So
Getting back to dire wolves.
yeah. Did you
How
see
much
George R. Martin? Yeah, sorry, go on.
No, I was just wondering. I mean, if you can
Mhm.
get those wolves going again, I wonder what's getting passed from that DNA. Can you pass anything from mental health from 10,000 years ago? There
Yeah, I
wasn't
don't
much
know,
thinking
man.
10,000. Just I'm hungry, I'm cold.
Yeah, are you thinking like maybe there's genes that were beneficial for the first mental health that these guys maybe had? Yeah, who knows? Who knows? I know that well, there's also the risk that we unleash a lot of viruses or something like that, and that affects our mental health too. I don't know.
Like
So
COVID?
yeah, I mean, well, I just read about there's these glaciers. Apparently, there's a lot of viruses dormant and probably bacteria too, dormant below the glaciers in the permafrost, and that they've encountered, multi 20,000 something year old viruses that when they cool them, like, or they heat them rather, that they start moving again or something. It's kind of crazy. But yeah, I don't know what we'll discover. I don't know. Do you want them bringing back some of these animals? I don't. I don't know.
No, kind of what I'm thinking is like
Yeah.
if there was something that got screwed up with my mom and dad, if I could just go the next generation before that, when it wasn't screwed up in the genes,
Yeah.
maybe get a couple things going there. That's all. I'm just saying. I wonder if that
Yeah.
gets into ethical things with
It it does make you wonder. And I don't, yeah, like I don't, what is it in Jurassic Park? They always decide maybe these animals weren't meant to live or something like that. But yeah, as far as I mean, stem cells, maybe stem cells could achieve some of what you're wanting, Pete. Yeah, conserving Radar brings up conserving species near extinction, like the northern white rhino. They could add back some necessary genetic diversity. I think maybe he's talking about. I think some of these animals, when there's only like 11 left, maybe they maybe due to inbreeding, but they have certain diseases that they maybe like genetic disorders or just things that are infirm about them. Um, that they can't get rid of because they don't have an example of a white saber-toothed tiger that didn't have that. I'm thinking of, it reminds me of Pete, if you know, I think certain dog breeds have a lot of hip dysplasia, and it's, I think, like a direct result of them breeding these down into these narrow lines. I could be wrong on that, but maybe if they had an example of a golden retriever, if such a thing existed, that didn't have the hip dysplasia, you could bring that
Yeah.
back to life. This is just a weird hypothetical to say what I'm talking about.
See, that's what happens when you have the social media guys running the neurofeedback podcast.
Yeah. Oh, just one
Because
thing. I brought up the direwolf. So the Game of Thrones author, they invited him over to hold he put up on his blog, he's holding the first direwolf in 10,000 years. And it's because the direwolf is like a big animal. It's the sigil of the Starks, or whatever, the main Game of Thrones family. Anyway, I bet you Radar likes that show, but some of us really liked it. So that's why I brought it up.
did you see that he bid on the throne and won it, and he had the two wolves sitting in the chair?
Oh, really? He did more photos or something like that? Or is this a,
Yeah,
oh,
you'll see it online somewhere.
he bought
Hey,
like a prop?
Talbo,
Yeah. Talabo's got a, there.
Talbo, welcome to the show. Thank you. I've been having to come up with questions.
I think Talabo, I think I saw she was asking, or they were asking, I think it might be a she, but they were
Yes,
asking
it's a
if you
she.
did the sleep breathing podcast. And I think I did see a sleep podcast go up recently, Saul, on
That
your
just
main
came up.
channel.
Yeah.
Yeah, I'll have to go check it out.
If we talk about it today in a week, the show will come up.
Yeah. There's while the that's how the sausage is made, I guess. Or great work takes time, I guess. Let's see what he's got here. You can breed out genetic diseases in some cases. Okay, so that's like the inverse. Um, yeah, I'm not familiar with what the inherent Hungarian Visa is, but it was almost entirely wiped out by the Soviets. Yeah, so Talabo says I'm a mom. Talabo or whoever on the sleep breathing or the sleep apnea question, I came across again this week. They think that up to 70% of long COVID sufferers have sleep apnea. That keeps coming up it was like 50 to 70. So there's some range there. Oh, Vija is a breed of dog. Okay, great. That's a great. And I don't know if I'm pronouncing. Apologies if I'm doing that wrong. Only 12 left, and their descendants had a ton of genetic diseases. And ever since the 90s, they've successfully bred out some of their issues, like a propensity. I wonder how they did that. I guess when you have so few, I guess, but if you just get rid of even if there's only 2 left, if they don't have epilepsy or something, maybe you can not breed the ones with epilepsy, I guess.
What do you think an EEG would look like 10,000 years ago of a?
Yeah, I don't know. I don't know if they think we were too much different. You probably have to go back further. Uh, but that's an interesting. Yeah, I think I'm too new to be able
Have we been
answer
around
that.
10,000 years? Have wolves been around longer than us?
Well, the thing is, I think that was it the Neanderthals have a thicker skull, so you'd have trouble getting the EEG out of them, or something. I'm just thinking of what I know about it. But yeah, that's interesting. Interesting question. What is the percentage of ASD children, autism children that have sleep apnea? I don't know. Let's look it up, see if there's anything good on Google. I'm finding that Google search engine's AI is actually pretty good because they give you the sources. Yeah, so Talabo, the first link I'm seeing here is something like 25% of children with ASD may have sleep apnea. So that is something to think about. I was getting the sense that maybe you guys are having a problem with the sleep breathing, and I hope something came of that. I didn't get to hear Jay's podcast, or Pete's podcast on that. I will tell you, Talabo, I think Pete even said this, that a lot of sleep apnea is positional. I think they say like literally 70% of sleep apnea is so-called positional sleep apnea, where if you change the side, it ceases or it goes away. Um, I'll also tell you, most of them are mouth breathers. Yeah. Yeah, interestingly, I know that in orthodontistry, they they have shown that mouth breathing is often a result of allergies. And there's a lot of famous cases. I think that there's a dentist, I think his name was Weston Price, that would document this. But basically, they think most famous example is they showed a child before they got their, like at age 8, let's say, and they look like a normal shaped face. And then they showed him at age 9 or 10, he looked like a different child, and he had a longer face, and they said he was mouth breathing now. They said it's because somebody had gotten him a gerbil and he's allergic. And so as a result, he started mouth breathing. So if you guys haven't checked allergies, that was kind of a long-winded way to get you to maybe consider allergies. They also say weight loss. So weight loss resolves, there's studies going on now with Ozempic, but weight loss resolves a large amount of sleep apnea. It's actually, so most people with sleep apnea, it's like 80 something percent are overweight. And that's actually just the case for the average American, in fact. Yeah, so Radar says he's on Ozempic for a few months and he thinks it changes the EEG. Radar, if you do ever find out, and please, I want to ask you,
Yeah, I'm curious about that too.
Yeah, if you've noticed any mental health effects that you're willing to share, maybe let us know. I know they say that it reduces craving. So that sounds like a great benefit. They say people, they're not just eating less, they're smoking and drinking less, or whatever their drug of choice. They're even doing less online shopping. They say people with online shopping addiction, they've tested Ozempic in. And I did read, Radar, if you just Google like semaglutide EEG, I found a study that said it seems to maybe increase theta. And I know and it might have been temporal theta where they were measuring, but I know from Jay's paper on ADHD and from his comments, I believe theta indicates extra dopamine release. So maybe that's how it's helping people with their addictions. But hey, Josh. And so we were
ask Joshua.
What's up?
Yeah, we don't know if you've heard, has Ozempic affected anyone's EEG that you've worked on yet?
It's not been really popular in our crowds out here. Yeah, haven't seen a whole lot.
You guys are thin up there.
What about granola?
We get a lot of hiking.
Yeah, the granola.
Yeah, right. We get a lot of hiking. We move around. We're not afraid of the rain.
Oh, that's a good one. Mm-hmm. Yeah. Well, yeah. So Radar, we hope it's working for you. Yeah. Sorry, go on, Josh.
Yeah, we just don't see people on Ozempic very often out here. Yeah. I don't think I've ever had a client who was on it. So I've always wanted to see what it does brainwave wise. I'm very open to it. Reduces compulsive behavior. Interesting.
Yeah. He says it can make people depressed in life. So yeah, reduces my appetite. I have heard those. Mm-hmm. I've heard sort of individual reports of, well, now that I don't want to eat, what do I do? I feel, anhedonic, or I'm not getting pleasure. But I will say, Radar, there are a couple studies. If you just want to Google Ozempic depression, Ozempic anxiety, there are actually studies showing it reduces those on average. I think I've even seen like 50%. Now, again, obviously, if somebody is having anxiety, talk to your doctor, et cetera. So it's individual, mileage may vary. Talabo brought up a point. While we're still on Ozempic, he says it reduces also libido. Okay, so that's interesting. Yeah, I hadn't heard that one yet. All right.
Well, some of those are not surprising when you're, losing weight. The brain is not going to prioritize libido. That's pretty typical.
Yeah, that's interesting.
And I would say that while we don't have a lot of information on what Ozempic does to the brain, we do, if we're stereotyping, what causes people to overeat. There's oftentimes a correlation with anterior cingulate dysfunction. And so I believe Jay did research on that. If he were here, I think he might speak to that. I'm thinking, what would Jay say? He would talk about that.
Yeah. He likes to talk about the Dirk de Ritter craving study with probably ILF or ISF. But yeah, I mean, if you just Google obesity EEG, you'll find it's associated with frontal slowing. So those slow waves and those are associated with if you have those in the anterior cingulate, that would be anterior cingulate failure. Yes. To Lava, real quick, I wanted to get in that she mentioned that she's aware. She did say that her child has allergies, as I speculated, and that she's heard that allergies and autism are correlated. I did not know that. Interestingly, I found out on my own, I had a sinus attack one time and I noticed my anxiety went up. And if you Google allergies and anxiety, it does increase anxiety. So it makes sense that it could affect other mental health issues, to me at least.
There's lots of studies around inflammation and mental health crossover.
Exactly.
Depression, highly correlated. If you're depressed enough, you'll have inflammation. If you have enough inflammation, you'll get depressed. Yeah,
exactly.
For sure.
It's the they said it was the inflammation, and they said that the sinuses are right near the brain, and so that's how that inflammation is getting. So yeah, I hate to hear that that your child is going through those right now, Talabo.
You absolutely will get some mirroring of the cytokines in the brain to the cytokines in the body. You can have illnesses that don't cross the blood-brain barrier that still will cause inflammation in the brain via the microglial.
Yes.
And the reason why it does that is because the vagal nerve will cause those systems to match and mirror each other. And the reason why they think it does that is so that you will feel fatigued, so that you will go lay down and rest, so that you'll get the physical rest you need. If you severed the vagal nerve, you could get the flu and not feel physical fatigue. You'd actually be sick, but not feeling as sick. And that's thought of as not optimal, as complicated as that is. Very interesting.
That was super interesting. I don't know if you remember what researcher or anything that was, because I'm saving that.
The Angel and the Assassin is a good book.
Oh, it's an Angel and Assassin.
Yep.
Okay,
yep.
I have that one.
You
know, Josh, I was going to mention, you mentioned vagal nerve. Well, I wanted to know what vagal nerve stimulators, which is people are using it for depression, also arthritis. You can buy them over the counter for like $300. But anyway, I wanted to know what they do to the EEG, because that's kind of how just like Radar's asking about Ozempic, what is it doing to the brain? And what I found out is, interestingly, VNS stimulators, vagal nerve stimulators, they increase sigma and they increase deep sleep, which we know is related to SMR. So I'm very convinced that vagus nerve is related to sigma, the sleep spindle, SMR. And it makes sense because vagal nerve is associated with parasympathetic, and so is SMR. SMR is related to the GABA A receptors in the subreticular thalamic nucleus. And Jay said, basically, he said 2 podcasts ago, he said, if you're training SMR, you're increasing your GABA receptors. Yeah. And so what you're making me think of is maybe SMR might help with allergies. I don't know. That's just a speculation. I do know that autistic sufferers, that's awesome. So validation there. And just one last, to bring it all together, autistic patients, they tend to have worse sleep. And I know that it's associated with subclinical epileptic discharges as one of Jay's EEG autism phenotypes. So, and SMR is the treatment for that. So who knows if SMR could help Talabo, her child, improve from maybe either of those.
Most people can learn sensory motor rhythm training. Most people can learn it. It seems like 80% seem like they can catch the learning curve. And I find that when it doesn't work, you can sometimes try different software, hardware, and sometimes you can catch the learning curve with a different approach.
That's
with
helpful.
You're dealing with little kids, you have to do tactile feedback. If you're doing like remote systems, small, funny stuff that are shipped to you, you can still get that into tactile by getting a Wooger. Do you know what a Wooger is?
I've never heard of this.
You're going to love this. A Wooger is something that video game people wear. It's a vest, just a little sash vest that takes audio sound and it turns it into vibration.
Haptic,
and so you plug the audio into the vest and it turns the sound into vibrations. And then you turn your audio feedback into audio and tactile feedback so you can get tactile feedback for your little ones. Because you need, especially if you're working with really, really, really little kids, you have to have tactile feedback for little kids. And a lot of people are like, well, we don't have tactile feedback. It's like, just go buy a Wooger. And I've looked at all the things, I could show you. This is crazy.
That's so cool.
Well, this is what they were using. They're using these giant, vibro-tactile systems that look like they were made in the 80s. We got like an old computer back here that's a box, and they're really expensive, really bulky, hideous.
Let me turn it on.
Yeah, no. Wait, this is a terrible thing, terrible. And I thought there has to be a better way to do this. And so I was just using AI software to try to answer some of my questions. And at one point, after doing a round of Q&A with it, it said, have you considered the Wooger? Yeah, it's a gaming device. Because I said gamers have all kinds of interesting vests. Is there anything that's cost effective that can turn audio into tactile or hepatic feedback? And it spit out the Wooger, and I went and checked it out. I was like, yes, that does the job.
So AI helped find this.
Well, I've been using that
cool.
for everything. I'm like 5 times more effective since AI came out. Yeah. I don't think
Which one did you say you're using?
I'm using Grok right now, but I pay
Grok,
for the Super Grok because it's probably 15 times more sophisticated than ChatGPT. So you can do a lot more with it. Yeah.
No, man, that is such a cool. This is why it's fun to get out in the woods sometimes. So kids do better with haptic, meaning touch neurofeedback, like vibration.
Jay did research showing that if you train down to 1 year old, you have to have hepatic tactile feedback. You have to.
Okay. And you said Jay did that research.
Yeah, Jay did. Gunkelman did. Yeah, they are responsive to tactile feedback at 1 year old.
You know, yeah, that makes me wonder how I heard on here that Seaburn has talked about at least neurofeedback in vitro or in utero, and like were they using
in the parent
haptic or tactile?
Oh, you maybe are you sure she wasn't talking about training the parent? Because she's known for
okay,
that.
there you go. That makes more sense. I didn't hear it firsthand. I heard it secondhand.
Well, there's a coy joke in the industry of like Seaburn's Fisher's children's developmental trauma protocol is to train the parent.
Fix the parent. Yeah.
So it was like 10 years back. 10 years back.
I like it.
I sent her an email and it was a picture of me with sensors on my head holding my daughter and looking at her. It was a really beautiful picture. I still have it. I'm just looking at my daughter and I've got sensors on my head. And I said, I'm using the Seaburn Fisher child development protocol. And I emailed it to her and she loved it.
Oh, that's funny. So it's helping you even is what you're saying.
Well, I'm co-regulating, but I'm regulating me. So
yeah, I like that. Well, you are,
Is a switch haptic feedback like when you?
I mean, the old days? In a way, not feedback to brainwaves, but feedback to other behaviors. Yes, yeah.
No, he's thinking good outside the box. And I like how you said that sometimes if you change the software, you can get a better result. To be honest with you, I know it's supposed to be about 80% respond to SMR, but I'm finding about 40 or 50% of people I know do not react well to it, if I'm being honest here.
It's tough. I worry that the sophisticated, beautiful feedback protocols that we have, the big flashy aesthetic stuff is working against our best interest. That, boring Pac-Man based feedback might be better. Like the old school, simple stuff. Your brain has nothing better to do than to see that this relates to me. And then these flashy, like beautiful, ethereal stuff is very complex. And there's maybe a lot of distractions built in there. And maybe that's not as effective as something that's just really off on black and white. There's no extra variables, just you and the responsive stimuli. And the only thing that moves is what moves in response to your brain. Very pixelated, And I'm not sure that's the case, but if you talk to older practitioners, many of them hold that position. And so that might be part of it. That might not. But I do, for many protocols, I try to go towards simpler feedback illustrations for clients that can tolerate it. So,
Radar made a point here.
Right? Yeah.
Oh, sorry. Yeah, that people may need fine tuning. I heard that Dr. Hill, whenever he's talked about it, he says he undershoots his SMR frequency, and that feels better. I certainly, I don't have knowledge of this, but I almost wonder, could it be that if you undershoot your SMR, are you now at danger of training your alpha? I'm a little curious.
If you undershoot it on the low pass filter, yes, but maybe not on the high pass filter. So you can arrange both ends or just one end. See what I'm saying? So if you pull the 15 hertz down to 14.5, 14, but not the 12, that's not going to happen. So it depends on how you do it.
He likes to do, he says, I do 11 and a half to 14. And obviously mileage may vary, et cetera. So I don't have any definitive knowledge of what's going on there, but
well,
it did
hence the reason for doing a really good cue and then knowing your cue really well, right?
Yeah,
if
so that would make sense.
Yeah. And I do wonder about this too, because I'll get people all the time who do consults with me from all over the world, and they'll bring in a case and they'll be doing SMR training, and they've got like, really fast alpha, like stupid fast alpha. And it's kind of like, dude, we're doing just 12 to 15 hertz, and you've got some alpha that bleeds into that band at 13, 14 hertz. Maybe we should try to get away from that a little bit,
Yeah.
Because it does seem to, SMR is small, alpha is huge. It's on the back of the head, but some of it gets there. Some of it makes it to the center of the head. And so I'm just a little bit worried about your ability to train when that big mountain of alpha is, going to hit your filter, especially if you're using any auto thresholding,
Yeah. So, so Radar's saying he's played with the tuning as well, and that it sounds like the lower frequencies were, one of those frequencies was more sedating, one of the lower frequencies, but he says, I feel like I've messed up my brain and now do better with a little bit lower frequency. I don't know what he means by mess up his brain. Maybe he can share, but it
affects arousal. And you can sometimes, you can sometimes offset. What's that?
I said, check the DSM.
Yeah, no, no, I think he's all right. But there's some theory out there where if you train too low, you can double up and go too high to offset. And some people believe you just need to go to where you should be and then double up the sessions to feel better. I find both theories seem to be true.
Okay.
So,
Yeah. So Radar, you can read it if you.
Good.
Yeah. He says it changed how arousal works in my brain now.
Yeah.
I don't know if Josh has experience. I do hear some people respond though to honestly a lot of different approaches that everything's been a little different since the last one I heard was alpha theta. I have a friend who says he's never been the same.
Yep.
He's felt dissociated years ago when he did alpha theta. But anyway, you can speak to HEG if you know about
brain it. I would. There are some cases where I would never do alpha theta on certain people with certain brain maps. And so,
who are those, by the way, if you don't mind? Like, if anything comes to mind.
Any frequency that's crossing over with the theta range that I'm training that I don't want to train.
Okay.
So precuneus theta, slow alpha.
Okay.
Inflammatory, stuff.
Got it.
Transients. Okay. There's just a whole handful of things that you could run into that just happen to bleed into that frequency that are going to falsely trigger the reward mechanism. And so, again, you need a good cue from a good provider that is going to think carefully about what is the software going to do,
Yeah. Any idea what may have happened with the HEG that Radar did?
Well, he doesn't say how it changed good or bad, but I've done HEG. It's fascinating. It seems I was confused about it because I would put it on and my temperature would just go up and up and up. And I wanted to know how far it would go. So I left it on for like an hour and a half. And I have reactive sinus tissue. I've had a few sinus surgeries, and I gave myself a migraine, which of course that can happen. I asked Santiago Brand, who was like, yeah, don't do that, dude. Santiago,
that's him.
But I knew I was being irresponsible, but I was like, what's going on? I want to see how high can it go? When is it going to plateau? It never plateaued. So then I was being more careful, but every time I put it on, the temperature would steadily go up, something like 1 degree every 20 minutes or something. And
that's incredible.
At one point I thought, how much of this is just my, skin warming up this device, which is kind of held by stilts. So it's like, it seems like it can't be much, but I wanted to know. So what I did was I put it on and I turned all the feedback, downsized it, turn the volume off. So there's no feedback, no tactile, no audio, no visual. It's all muted. It's all downsized. And I left it on, but I turned it on and recorded it. And I wanted to see how much it went up. It went up like 1/4 of a degree in an hour. And so it's training. Like that's what it's doing. It's training. And it's crazy because it's a very consistent response. That blew my mind. Like that's a very, very strong blood flow response for training.
Yeah.
That's like, okay, we got to be careful with this because do you want to increase blood flow in your OCD patients? Like, no, don't do that.
Interesting. Yeah. So that's what I was wondering because blood flow is associated with high beta, I think, too, right? Is that what you're getting at?
It could be. There's actually an article where it'll show you all the different, all the different perfusions at what frequency.
Yeah.
But if you're talking about non-disordered frequency, so cingulate behavior, you can basically, long story short, theta in the cingulate is generally hypo perfusion. No, it's hyper. It's hypo when it's an injury, but hyper when it's cingulate. I know. It's not what you think. Look it up. Look it up.
Yeah.
I know.
Okay, I'm going to save this though, but I like that. I like that. Yeah.
Then you have like slow edge of alpha. Slow alpha is hypo. Alpha 2 hyper. Okay.
Yeah.
And then there's I'll dig it up. I'll dig up the study. I've got it buried in my server. I'll send it to you. Fascinating.
That's really neat. So the idea sounds like you don't necessarily want to amp blood flow, especially if it can increase. So for example, theta is very big in OCD patients.
Yeah.
So is alpha. I'm sure that a beta is another one I think Jay calls for OCD. But yeah, beta is hyperperfusion as well. I don't know if it's hyperperfusion every area. The chart on the perfusion is Ian Cook, UCLA. Perfusion in the EEG, just if anybody needs to look for it.
Yeah, I think you're right.
But that's interesting about the theta being different depending where it's at. So
yeah, well, you're talking about it being like the normal theta rather than it being like from an injury or something. So I think in somewhere, if you read the study really carefully, it specifies that kind of stuff. It's been a little while since I've read it.
Well, it makes sense.
But yeah, frontal midline theta. Go ahead, yeah.
Joshua, before you got here, the topic was direwolf.
Oh, yeah. I haven't spent the time to dig through if this is like a fully converted gene, direwolf, or did they just change 6 to 8 things? Like I want to know.
I'm just throwing it out there because I'm waiting for somebody else to ask a question. But if you're passing on whatever issues you have to your kid, is it possible if you had an upbringing where you're anxious or whatever it is, you pass it on to your kid? Is it possible to bypass your whatever genes were passed on to you, go to the next level up, and rework your genes so you don't have the mental health issue, whatever it is, Joshua?
Can you ask the question one more time? I'm sorry.
I don't know if I can. I'm looking at the dire wolf. If you can bring back something that's been dead for 10,000 years.
Yes.
Okay. Is it possible to go through your generation? Let's just say you dig up one of your ancestors that didn't have the defect and you somehow get a hold of that genome, introduce it into your own to weed out whatever the issue was that was passed down. Do you think that's something that could happen?
So I have a lot of thoughts on this. I don't know if they're podcast friendly, but we kind of are likely going to need. I'm curious what Radar meant about that.
Or go to that.
But we are likely going to need to do something with our genetics. Yeah, stimulate OCD. Yeah, that's what I thought. Radar. Yeah, it's stimulating. So HEG is activating. We are going to likely need to do something with our genetics. And here's the argument, okay? Rewind the clock 10, 15,000 years-ish. I don't know, 8,000 years, somewhere in there, before the time of Abraham. Most scholars agree that the world was mostly just hedonistic is kind of the word they all use. And this isn't like a religious claim. This is just like a historic claim. There was small pockets of civilization, but nothing that included things like hygiene. we didn't have like really prosperous, really successful. I mean, there's some weird pockets of things, but nothing that led to where we are now. Okay. Like, and that's the big difference. Nothing that led to where we are now. And we have really done a really good job of giving survival of the fittest the middle finger, which is awesome. And I'm 100% in support of it. But there is an interesting long-term consequence for just giving survival of the fittest the middle finger forever. And we are going to have to find mechanisms to resolve those consequences. Okay. So we have to figure out how to fix our own genes, because we do tolerate disease. We tolerate it very well. We tolerate it so well because we're extremely benevolent. We're extremely generous. We are extraordinarily counter nature. And those are all positive qualities. If I want to be extremely specific, those
duly noted.
Those values are extremely positive according to my value system. Okay.
Duly noted.
But they're not natural. And we will have to contend with the consequences, which we can. That's the cool thing. We actually can. We are 10 to 50 years away from having that totally solved. And it's probably closer to 10. Yeah.
Radar says mutational load increases because the weak and sick aren't killed. So
that's a more honest way of stating it, that I was trying to be dialectical, but Radar said the thing. Yeah. Radar said the thing.
What it's making me think of a little bit is like, I doubt it was easy to survive if you had bad vision years ago, and now you can, maybe as like a crude example. They think some of that is just because we don't go outdoors, so our eyes are not forming properly. However, maybe some of it is just because we're...
How many of you have been on antibiotics?
Obviously, yeah, for sure.
What do you mean, obviously? Let's think about that.
I'm a human, right? Like, I'm just saying the odds, yeah.
Yeah, but like, what would happen if you weren't on antibiotics?
Oh, yeah, we would have passed away. You're saying, yeah.
Wait, at what age?
Syphilis.
I don't know.
I'm serious, mentally.
It's
been a while, but it's
cruel,
for sure.
Nature's hard. Now that we tolerate disease extremely well and we can cure some of them, but we also put up with things we can't cure, which is extremely good. But we don't really have mechanisms for weeding out weakness, because we put up with not just weakness, but we put up with brokenness too. And that's extremely positive. And we've built a beautiful society that will solve the cost of that generativity, which is awesome. But it's complicated because there isn't a model for that anywhere else in the universe. And we're going to do it.
Yeah.
Like,
I'm a little nervous we're getting into empathy as a weakness or something, but
no, I'm the opposite. I'm like, let's say the truth and say we are so awesome that we can solve it. Like, we can say empathy looked like a weakness and we got ahead of the problem anyways. You know?
What I would say is these things, as long as they're aligned with improving well-being and longevity, it's fine. Like, we're going to, ideally, we would solve any sort of deficiency in our species. We would dissolve it on our quest to live forever and to be happier and more productive. So I think that is a natural. I think that will occur.
Have you looked at the fetal gene therapies that are coming out?
No.
No, you haven't seen that, Anthony?
No.
Oh, I'm sure I forwarded this stuff to you.
Are you talking about
why don't you tell us and all the listeners?
So they figured out how to induce fetal genes, which cause you to create tissue-specific stem cells in mass quantity, and they can induce that on each tissue individually. And I think I know how they figured it out too, but I'll leave that to myself. And so they have 80-year-olds right now in a clinical trial where they're just giving them 18-year-old vision, and they give them a shot which turn on the genes, and their eyes just renew. They can do that with the skin, they can do that with the heart, they can do that with the brain. They've been doing it on lab rats. And if you were to scale what they've succeeded on lab rats into human years, if it works the same way, we would live to be 180.
What's the name of the organization or the company, or do you recall? Or?
I'll track it down and send it to you. I'm sure I sent it to you before, but I'll send it to you again. I don't recall the specifics. I just know that it's about fetal gene activation. And right now, the easy way to find it is look up the human trials on eye therapy for 80-year-olds. That's what they're doing. So they're giving really old people like crisp clean vision. With just
that's really good.
Mm-hmm.
And
now,
radar makes the point. Yes,
you know we can do this. You know why? Because we can have children really old, right? Mm-hmm. Now, your telomeres unravel when you're getting older, right? But if you're 50, you have shorter telomeres, right? But if you have a kid who's 50, if you have a kid when you're 50, you don't have a kid with telomeres that are 50, right? So you can acknowledge we obviously have backups, obviously, because we use them for reproduction. Yeah,
there's a mechanism to start over, reset it. Radar makes the point here that we can, and good point, Josh, but he says maybe some of this essentially we can address with neurofeedback. So if a person is born or experiences, he mentions autism, but I'm sure we could say this of a lot of things neurofeedback treats, and then we can get in there and maybe it doesn't matter as much that your dad was an insomniac or your dad had ADHD or your mom, whichever, that we can help you. I think that's a really good point, Radar. And again, I mean, with medical technology, I mean, in a way, glasses are correcting Darwin or natural selection or whatever. So we're kind of fighting against nature.
Anthony, why don't you take care of Talabo here?
What was Talabo's? Was it about
it's more of a statement?
Breathing? Oh, that was Talabo's statement. That was the one I was addressing. Talabo mentions, if your child is autistic and maybe you have a more dominant hemisphere, I think she says the left, that potentially your neurofeedback could help you address the hemispheres. And I think that's great. I would really love. And Talabo, I wish you guys a lot of success on that. Yeah. Yep. Allergies is one that I know a lot of people have had trouble, as well as, let me see if there's anything in sleep disordered breathing that I have notes for Talabo, because I know they're having trouble with that.
Yeah.
If Josh wants to comment, I know Josh has experienced probably a couple, but I know you had non-obstructive sleep apnea for a while.
Yeah.
So maybe you have insight for Talabo and her child. Yeah.
Well, I don't, my story is kind of weird, and I don't want to be a model for anybody, and because
I don't sharing, know, I apologize.
I'm comfortable sharing it, but I want to be really careful, I don't want people to be using mine as a model.
Very wise.
There's a lot of different types of sleep apnea out there, and what I figured out with mine is far from traditional. And I watch it like a hawk, because I assume it could regress at any moment. And so I wear monitors that will wake me up if my oxygen were to dip, even to 92. It will wake me up. It'll alert me. But I did figure out things, and I don't know how much of that was environmental. I don't know how much that was habitual. I don't know how much that was general health. But I've changed some things, and maybe it was learned. Maybe I learned through basically I had a device that would alert me whenever my oxygen dipped, and it would wake me up. That would do that 15 times a night. And then after a couple of nights, it was 7 times a night, and then 3 times a night. And then eventually, months and months in, it stopped waking me up, but once a month or once a week or something. And then eventually not at all. So I dialed the settings in to be more aggressive and kept doing that until it's like set to like 94 or 92 now. And it still never goes off because I don't go that low in oxygen. I never have dips like that.
That's great.
And it isn't obvious why it did that. It isn't obvious that there was learning occurring in a biofeedback way. It isn't obvious that I changed sleeping positions unconsciously, or that I changed my eating habits, or I changed my sleeping habits, or that I got healthier. It could have been all the above. Who knows? And so I did want it to be a model, but I do think that the takeaway lesson in this is get monitoring devices and learn and get as much information as you can about yourself. And you can always be your own expert. You won't be the expert on sleep apnea. You won't be the expert on maybe whatever it is you're going in for, but you can be the expert on you. And you should walk into the room with a provider with that attitude. And we don't mind that if we're good providers, I think. I want
That's
my
good.
clients to partner with me. I'm bringing half the coin, which is the specialty to neurofeedback, and I want them to bring their specialty of themselves, and I want them to approach it with a level of like intentionality. So
I think that's great. An MD friend said similar, that like a doctor should sort of be incorporating your feedback and listening to your experience, and that is part of like proper clinician or therapeutic relationship. To Labo, I did just want to mention, I had a list here of some things for sleep apnea. You know, I've had friends that these have worked for. For instance, there's something called oral appliance therapy. Essentially, you can get a mouth guard from a dentist, and there's at least one clinical trial showing that that was more effective for sleep apnea than using a CPAP mask. And I have even one better. A friend of mine, he was lethargic ever since college. We knew him as the lethargic friend. We would get to his house to go somewhere at 9, let's say, and he'd be waking up from a nap. And he was like this for years. And then one day he calls me out of the blue to say, "Man, I used CPAP mask, did not work." And then because out of desperation, I ordered a snoring mouth guard from Amazon for $18. And you could hear it on the phone. He sounded like a new person, kind of like the way Josh has sounded to me, a little different this year already, since making an improvement in his sleep breathing. So consider, Josh, and props to you. So you can get these, you can try one of these mouth guards to Labo on Amazon. And then he recommends, he started with that and then he upgraded to one provided by, it's called a sleep dentist or sleep dentistry. A lot of dentists are now providing these. Just a couple other things. We mentioned avoid sleeping on your back. Pete mentioned the other day you can tape like a tennis ball to your back if that's causing it. You know, this is all, your mileage may vary. Weight loss I mentioned. Some of these breathe right strips some people recommend. Chin strap to keep the mouth closed. That was a new one to me. I'm not obviously, use at your own risk. We're not doctors here making recommendations, just something to think about. There's even one last one. Jay Gaddis, who works at the Amen Clinic that I know Josh knows, he recommends an app called, Snore Lab and Snore Gym. And one of those, I think, is Snore Gym, because snoring is related to sleep apnea. So this app gives you exercises to Labo for your tongue and for your breathing muscles of the throat and the lungs. And he has found you measure your progress with the Snore Lab. And by the way, I agree with Josh. If you can, get something that will measure your O2 at night. There's usually fairly reasonable O2 monitors, they're called, on Amazon. And you can pair it with one of these apps like Snore Lab and Snore Gym. And hopefully you'll see, if you're measuring, you should be able to see, the night I did the night I did the exercise, I can sleep better that night. I just wanted to give that to you because I feel so bad. Oh, and one last, they say, consider humidifier. Maybe your house is dry. So be like Josh. If it's not coming together with the first therapy, I wish you luck and keep trying.
Sleep seriously. Like, sleep is one of the most important things that we could do with our time and energy to fix. It's work, but it's worth it.
The return on investment. What's up, Pete?
I was going to say, Jay Gunkelman got into sleep on the Neurofeedback podcast that will be posted tomorrow. He gets into sleep was a big issue last week, and it's carried over into this week. I wonder if it has something to do with the time of the year. We should be getting more energy.
Allergies.
Oh, look at you. The sun's gone. Never mind. I'm looking at Joshua.
It's not. Yeah, it's mostly gone, but it still feels like it's better than usual. Yeah, it's.
Josh, if we're in Washington State or in the area, or if we want to get some remote services, how do we find out more about you? Because you seem pretty smart on this show.
You can look us up at neurofeedbackcare.com. We hope to be launching some. He asked if I has a lot of experience with ILF. FP1, FP2 inherently causes sympathetic activation regarding frequency training. Yeah, you can do FP1, FP2. It's considered, it works for those that it works for. So we do a lot of, to kind of cover Radar's question real quick. You can do a brain map, and not a lot of people do brain maps and then incorporate ILF. I have, and let's just say that if you have instabilities, you're not going to be doing FP1, FP2. Like that's just not going to happen. Okay, with ILF at least. So that's not going to happen. And people don't know that because they just don't do both modalities. You're going to do a lot of T3, T4 if you have instabilities. And that's the kind of dynamic you're looking for. Am I looking at this type or this type? You have to know how to sort them. Some people do like the frontal lobe training stuff, and those are kind of a unique blend. It's going to be maybe 1 in 5 people at the most. It's not that common. So,
and then Anthony Ramos, if I just happen to be on Facebook and I want to get my technology fixed, where do I go?
Thanks, Pete. You're always very gracious at that. Yeah, Facebook Science and Technology Discoveries. Was going to mention, I know that YouTube has anonymity, but you can definitely just join some of the neurofeedback groups on Facebook and just kind of hang in the rafters, so to speak, or in the background and glean information. Jay has answered a lot of people's questions, as had Josh. So if you ever have a neurofeedback question, you can pop into one of these neurofeedback Facebook groups, pop in Jay Gunkelman, sleep disordered breathing or a sleep apnea, and you're going to find stuff. So, and then also, I just wish luck to our favorite audience members today that, you know, with their journeys that they described, and thank you for sharing them with us.
And real quick,
go ahead, Joshua.
Talabo asked about a recommendation for the Midwest. Talabo, if you go onto my website and you just ask on like the little email box and put your zip code in there, I'll find you somebody. Okay. So
that's very nice.
I do that all the time. I'll find you. I'll find you people that I like in your area. Okay.
We're in the Midwest. I'm in Chicago. I'll tell you where not to go.
Email Pete then or something.
And if there's something that we didn't answer correctly or whatever to your liking, email pete@neuronoodle.com and we'll use it as content for our regular podcast that we put out there. Thank you for everybody showing up to the Neuronoodle Neurofeedback Q&A with our esteemed panel, Anthony Ramos and Joshua Moore. You never know who's going to show up. But if you do, your question will be answered.
Yeah.
All right, guys.
Well,
thank you so much.
Thank you, everyone. Have a nice evening.
Bye-bye.
Take care, guys.